Sometimes you can make these things really complicated. But at the end of the day, sometimes it just boils down to moving. Just move in different ways each day.
A new study published in the Journal of the American College of Sports Medicine found a short stroll at work every half hour could help with the harm that comes with prolonged periods of sitting.
One thing that people sometimes don't join the dots, they believe that popping a medicine can take away the pain, but they're not going to the root cause, which is... So Dr. Tom, as an orthopedic physical therapist, how would you simply explain what rehab really means?
There's lots of different types of rehab. Even though I'm in orthopedics, orthopedic rehab, orthopedic physical therapy is what most people think of. It's most of the common conditions: back pain, neck pain, ACL tears. Rehab, I think in a nutshell, is
back pain, posture issues. Why is this becoming so common now? Is it posture? Is it stress? Or is it something else?
the body and the nervous system is very resilient and is meant to adapt to all these different postures. Now we say your best posture is your next posture.
I believe that workout should be bio-individualized. So do we need to personalize exercise for everybody or follow standard protocols?
Everyone's anatomy will vary slightly, and so that means their biomechanics are going to vary slightly. I think in the vast majority of cases, most people, if they're doing exercises that don't apply extreme load to their system. So this is where biomechanics is relevant. Biomechanics is sort of...
Hey everyone! Today I have someone really special with me who has changed the way I think about posture, movement and mobility. Dr. Tom Walters is a board-certified orthopedic physical therapist and the founder of Rehab Science. In this episode, we talk about why movement matters, how small daily habits affect your body, and how simple mobility practices can help you move better and stay independent as you get older. He also breaks down common myths and everyday mistakes we all make in our daily lifestyle, like how we sit, stand, and move throughout the day. I truly think you will take a lot away from this conversation. So let's get into it and watch it till the end.
What about you? How's your practice? I mean, what do you do? Where do you practice currently? And I love the book, by the way, the rehab book.
Thank you so much.
Written very beautifully.
Oh, thank you so much. Actually, this space I'm in right here, believe it or not, is very blessed in a lot of ways too. This is a structure just down, I can see my house. So this is just down from my house. And this has become my podcast, YouTube studio, and also my clinic. So I see patients in here. I have a little treatment table just sitting back here. So I will move things around. It's always kind of shifting a little bit depending on what I'm doing. But I have patients basically come. It's nice that because it's detached from the house, they can just come down and I can see patients in this room. So yeah, it's really kind of a mix. I have some patients where I go to their homes. But, you know, in the US, our insurance system has a lot of problems with it. And so I left that a long time ago. And luckily I'm in a community where there's enough
practice?
Private practice. Yeah. There's enough people here who can just pay cash to come see me and I spend more time with them. For me, it's much better because I see less people and I spend more time with each person. So the quality of care is just so much better. But yeah, I kind of split my time between seeing some patients and then I have working on books. I'm going to launch an app soon, a Rehab Science app that, just like you were talking about, I am so motivated. I've always wanted to help people on a larger scale, and seeing one person at a time is great, but it wasn't as fulfilling to me. I've always wanted to help more people. And for a while I taught at the university here.
That's amazing. You know, I've been watching your YouTube channel and the Rehab Science book that you wrote, which is so cool. So Dr. Tom, as an orthopedic physical therapist, how would you simply explain what rehab really means?
It's a great question. Rehab, I think in a nutshell, is there's lots of different types of rehab. So I think this is helpful for people to know. Even though I'm in orthopedics, orthopedic rehab, orthopedic physical therapy is what most people think of. It's most of the common conditions: back pain, neck pain, plantar fasciitis, ACL tears. Those all fall in the orthopedic type of physical therapy, but there are other physical therapists like pediatric physical therapists that only treat kids. There's geriatric physical therapists. There are neurological physical therapists that only work with patients with neurological diagnoses, so like after a stroke or a brain injury. So I would say if you consider all of those different areas of physical therapy, basically rehabilitation and physical therapy boils down to looking at problems with the movement system. So looking at impairments in the movement system. So that could be a lack of control. It could be a lack of balance, a lack of mobility, a lack of strength. It's looking at all of these impairments related to the movement system and then coming up with a treatment plan to restore or correct those impairments.
Wonderful. I think the general public always perceives that, oh, if I'm broken, I need to go into rehab. But I do martial arts like you did. I have done Shotokan, which is a Japanese form of karate, and now I'm pursuing Shitoryu. And I've got one of India's best senseis working with me. But at the age of 50, it's really difficult to get your twists and turns where the hip doesn't want to move, but the knees want to move. And that's when I met my physiotherapist, and he recommended to me that you need to do proactively rehabilitation, even if nothing is broken. So, is this something that the world should begin to explore, especially people who work out? And what is the age that they should maybe start this preventive rehab, if such a thing exists?
Yeah, I couldn't agree more. It's this idea of prehab that we talk a lot about now. And like you said, most people only think of rehab interventions, mostly exercise, because most of rehab, the intervention that has the best long-term research is movement and exercise. And they're not exercise like I'm just going to go for a run or I'm going to ride the bike. They're very specific kind of therapeutic exercises in most cases, like giving somebody a specific exercise for a specific muscle group or a
Could you
specific
give me an one
movement. Yes.
example?
Yeah. So, like one, let's say that maybe you'd give to people is an exercise called side lying hip abduction. So, that would be your hip abductors, which are on the outside of your hip. They're primarily our gluteus medius and gluteus minimus muscles. So people kind of feel kind of that outer back pocket of their buttock region. That's where gluteus medius and minimus are. And those two muscles are really important in terms of controlling our femur, that long thigh bone, and controlling our pelvis. And so, you use these muscles, those muscles, you use them all the time when you're running and walking. But in a lot of cases, if somebody has a problem with those muscles, just telling them to go walk or run and just do general exercise won't be enough. You need a really specific therapeutic exercise. And so that side lying hip abduction exercise is basically an exercise where you lie down on your side, and the leg you're targeting is on top, and you lift your leg up and down through hip abduction. So it's a very specific movement, knowing kinesiology, kind of the fundamentals of human movement. What are the actions of this muscle? And then you're creating an exercise, you're prescribing an exercise that specifically targets the actions of that muscle. And so when we think about rehab and physical therapy, there are lots of different interventions that often come into the treatment plan, but the one that has the best long-term evidence that the patient will continue with and use on their own is therapeutic exercise. It's kind of those examples. So, and what I would say is most people think of that as when I'm hurt or I'm injured, I go to physical therapy, the physical therapist helps me in some way, and then when I feel better, I'm done. But we really are so often trying to help people understand that these types of exercises will help you when you're in pain or injured, but it's all about just general musculoskeletal health. And a lot of physical therapy revolves around exercises that promote mobility, stability, and strength. And those types of exercises will not only help you get better, help you rehabilitate, but they'll also help reduce the risk that you have an injury in the future. We really try to help people understand that this isn't this temporary thing that you do for 6 weeks and then you're done. We try to help them make these kind of positive long-term changes where maybe they're doing the exercises less often than they were when they were injured, but when they're feeling better, still just when you have your general gym routine where you go and maybe you run and you lift weights or you do yoga, just incorporate some of these exercises just to keep your system healthy. And there's lots of research showing that when people do this, it reduces the risk of injury. It's not perfect, right? You can never 100% of the time prevent injuries. You could step funny and sprain your ankle, or something could happen that you can't control. But we do know that incorporating prehabilitation exercises can reduce the risk of injury.
That's so true, and because I practice with elite athletes and I also practice with millionaires and billionaires, I have two types of clients: the vain client and the pain client. The vain client will say, I want to work out. I want to make my body feel good. I was a sports person in college and I continue to work out. The pain client is the one that, like you rightly said, they'll get an injury, they'll come for the rehab, or they'll come for a weight loss diet plan, or I've got a fatty liver, I've got a coronary block, I need this nutrition. And they think that if they do that diet or they do that prehab for a small period, that everything's fixed. And there's one thing that, Tom, I say to all my clients, and I'd like to offer that to you, is this. You say to your clients, your body is the most expensive real estate you will ever own. And do you live in it as a tenant or do you live in it as a landlord?
I like that. That's such a
So
great way
when
of,
my
yeah.
adductor or my hip or my ACL is hurting, I'm behaving like a landlord and maintaining my house because this house cannot be changed till my last dying breath. So I've
Yep.
got to do the maintenance and the food, the sleep, and the movement. So you and I are very important. And I start most of my counselings that way. When people say, give me a nutrition plan, give me a diet plan, I'm like, you're going to be here with me for 1 year. I'm not going to start you off on a nutrition plan. You send me pictures of what you're eating
Hmm.
and let's figure out how you've started these choices of eating. And I think from a movement point of view, I always tell my clients, go meet a physiotherapist, go meet a strength and conditioning expert, recruit them for 270 days. They said 21 days to make a habit, but that was for the very disciplined people. The very lazy people in the study went up to 270 days. So everyone started 270 days.
I love that. I love the idea of the landlord versus the tenant. I'm gonna have to steal that and use it with people because I get the same. I get the same types of people. I get the people who come in and sometimes they'll literally say, I don't care what needs to happen, just fix me. And they put it on me. It's very passive. You know, we talk about that in physical therapy, sort of passive versus active mindsets and active versus passive interventions. And some people just say, fix me. And it's completely the wrong approach. You know, they're looking at their body as a tenant and just someone else is going to come in and fix it for them rather than the people who come in and they really do look at as a landlord situation and they're taking control of their body and they're interested in what do I need to do to self-manage this and not just rely on someone else to fix it for me. So I like that a lot.
So speaking of the landlords and the tenants that come to our practices, many people these days, most of us, including you and me, will work at a desk a lot of the time. Like I'm at a desk in my counseling clinic all the time. And in Bangalore, where I live in India, it's predominantly a software technology city. So everyone's at desks. Yes, they're getting standing desks nowadays, but it'll be 1% of the population, 2% of the population. So back pain, posture issues are there. Why is this becoming so common now? Is it posture? Is it stress? Or is it something else?
It's a great question. We used to blame it on posture for a long time, right? When I came out of physical therapy school 18 years ago, we spent a lot of time looking at people's posture and really worrying about do they have their shoulders pulled back and down and, you know,
I
what's the
just I
alignment of
just
their
did the
Yeah, I
adjustment.
saw yeah, we both adjusted. And so more so nowadays we say that we try not to demonize any one particular posture. We've sort of moved away from that. The body and the nervous system is very resilient and is meant to adapt to all these different postures. Now we say your best posture is your next posture. And so the way of thinking about that is that our movement system is designed to move regularly. And so usually when people start to develop pain, associated with sitting at their job, or maybe they have to stand for long periods. Maybe they're a nurse or someone has to stand at a hospital. Usually it's not because the particular posture they're in is necessarily bad, because even if you take a really good, so quote unquote, good posture, right? Like shoulders pulled back, sitting up straight. If you make someone do that for 5 hours, it will start hurting. So it's not really that like people think about like the military posture. We used to think that was kind of the gold standard. That's what we used to literally hang a line from the ceiling and see if people lined up with it. Did they look like the military posture? And you would tell everyone to do that, but then some people would go on to develop pain. And so really more of the concern now is that people are too static and too sedentary. And so we're really shifting our message to encouraging people to move frequently and to not worry so much about, you know, are they in the right posture? Because people can really latch onto some of those things and become really hyper vigilant and worry about their posture. And so you mentioned stress. Stress is definitely a big part of it. Pain is so multifactorial. It's this multidimensional experience. And so anytime someone has pain, especially if it's a pain that starts to lean towards being chronic, maybe it's been there longer than 6 months, we start to look at things that aren't just the musculoskeletal system. Like what are all these other nutrition, their sleep hygiene, what is their stress like, you know, looking at potentially like anatomical factors, looking at their social support system. There's just a lot of things that feed into our nervous system and our immune system. And pain is really thought about from this multi-dimensional experience. You can't, if you only look at the physical side, you know, you look at how tight are your hamstrings, what's your spinal mobility like. If you only look at that, especially in people with chronic pain, you'll only be looking at one little piece of the whole puzzle. So you have to really consider, and you know, when you talk about sitting at a desk, things like that, usually these are people with spine pain. Usually they have low back pain or neck pain or both. And so, yes, you have to consider your ergonomics and your behaviors. But you also have to look at non-musculoskeletal, non-mechanical factors like your sleep. How much sleep are you getting? How much alcohol are you drinking? How stressed are you? Stress is probably one of the biggest ones I see overall of people. The people who really have this issue with kind of developing chronic pain symptoms, often it's that there's some stress outside of a physical stress, like relationships or work-related stress. There are things that are kind of tipping their nervous system over the edge and making it feel really threatened. And when that happens, you're more likely to experience pain.
If Dr. Tom was working in a tech company in a different avatar or a life, what would you do knowing who you are today in therapy and you became a technology guy? What would you do different in your office setup? Or are there any tips that you can give us that would help somebody knowing that they're going to go through the rest of their 20, 30 years of working life in such an environment? What are the quick fix tips that Dr. Tom recommends?
Yeah, I would say we're getting better already with having walking desks. Walking can be huge in terms of reducing the likelihood of developing musculoskeletal pain. Obviously, you have to be careful with that because if you just start walking miles a day at work, you might develop plantar fasciitis. You can get overuse conditions from walking too much too. So it's really about the key to me. If I had all the control over jobs of that nature, I would implement. The key is to vary stress. You have to vary stress on your system. So if we're thinking about the musculoskeletal system, it boils down in a lot of cases to mechanical stress. So if you stand all day or you sit all day in one position, you are applying the same type of stress, the same magnitude of stress and direction of force and to your system all the time. So I would look at trying to get people, look, if we think about humans as being hunter-gatherers at one point, in those times we moved around a lot. We squatted, we ran, we were doing kind of lunges, we were bending over, picking things up, we were walking. So as much as you can, you want to try and incorporate regular breaks into your day that expose your musculoskeletal system and your nervous system to different types of stress, different types of movement stress. So it might mean that you set a timer. Maybe you have a timer and whatever's realistic for you. Obviously, you have to get work done too, but maybe you start with something like a sit-down stand-up desk because that alone is just a really easy way. And you set a timer. Like every 30 minutes, I'm going to go from sitting to standing and then back, and I'm just going to alternate. That's an easy way to just start altering stress. Maybe I want to get a desk. Maybe I want to do that, but I also want to have like a walking desk. I just got one myself. And so I have 2 girls, 2 kids, and anytime they want to watch YouTube, I make them walk on the walking desk. So they walk on that. Instead of sitting on the couch, they walk on that and just keep the movement going. Maybe you can't get one of those types of desks. So just set a timer, like maybe it's every 30 minutes or every hour, and just have a little set of movements you go through. It could just be air squats. It could be lunges. You could do some stretches for your arms and legs. You could just be doing sort of like arm circles. Like just find a way to introduce movement frequently throughout your day, and you'll be much less likely to experience musculoskeletal pain.
I give a small tip to a lot of my tech clients. I'm like, keep a small water bottle and it should be only like 300 ml or 400 ml. I need you to fill it 5 times in the day. So I need you to walk to the water cooler. When you fill it in the water cooler, try and squat down and fill it in a squat position, fill
Yep.
it. And then, you stand up, take one sip, standing up, take a next sip, squatting down, and then get back to your desk. Before you get back to your desk, wheel the chair in front of you, do a little bit of movement here, dance with the chair, and then get back in. And once they start doing that for a month or so, then I'm like, you need to meet somebody like Dr. Tom. I know, just go and get a hamstring to a quadricep ratio and see the balance on that. So a lot of people today in modern day jobs, they want data, and when you're able to show them data, they're like very enamored. Oh, my bicep to my tricep strength is not that great. It's like, okay, there's not less mobility here. So that's what I'm doing, and I think I would advise everyone to always go and meet a person like you, even if nothing is wrong with you, just to understand movement, just to understand posture, just to understand a niggle here and there is actually maybe something that is being caused in your workplace, and a small fix by an expert can save you years of chronic pain or medical bills. But I want to ask you another question, which is, this is the proverbial thing that even when I'm looking at it, should I invest in the mattress? Should I buy a sexier chair with lumbar support, or the lazy boy couch that I lounge when I watch TV? Is there something special? So if someone wants to invest in something safe for the the biomechanics of the human body. You said the standing desk, and I totally echo with you because I have one in the office and it's changed my life. What are the two, three, four things that you can recommend to people that, hey, buddy, instead of buying that Gucci t-shirt or Gucci bag, could they invest in something that's occupationally far better for their body?
Yeah, such a great question. I haven't had many people ask me this. I think, I probably really would consider, probably first off, when it comes to the musculoskeletal system, probably one of the things that would occur to me first, the pain system, the musculoskeletal system, is thinking about how well you're sleeping. I went for years on a mattress that kind of hurt my back. I had this spot in sort of my right thoracic spot region near my right shoulder blade that always would hurt me when I was sleeping. And it wasn't until I switched to a firmer mattress. My body does much better with a firmer mattress. That pain pretty much resolved. Because we know our musculoskeletal system, there's so much healing that goes on when we sleep. I think sometimes people are becoming a lot more more aware of the importance of sleep, but I think that's probably a big one. And there's no one size fits all. Sometimes people ask me, like, what's the best mattress or what's the best pillow? The best one is the one that works best for your body. So you have to test them. It's like thinking about testing shoes. Like, people, this is second nature to people. They go try on shoes and test them out and see if they feel comfortable. You need to do the same thing with your mattress type, your pillow type. And there are lots of these companies now that will let you test things and kind of see, does it feel right for your body? But there's no one size fits all in the musculoskeletal system. You really have to, it's sort of like a fingerprint. I tell people sometimes that your pain system is like a fingerprint. It's completely unique to you. And so your perception of things is different from everyone else. So you have to think of it as an experiment and try things out for yourself. But I would say, because there's so much healing that goes on with sleep, I would say those two elements, that mattress and pillow, are really worth thinking about and finding the thing that allows you to get the best, most restful sleep. If you are someone that has to sit a lot at work, then I think it is another example of where, first, I would tell you, try to take movement breaks. Sometimes we call them movement snacks. That's kind of a terminology used in the physical therapy world a little bit now, kind of like you were talking about filling up the water bottle. Like, think about movement snacks throughout your day. I would say start with that. But then think about your ergonomic situation. Like, think about your desk. If you're using a mouse, like maybe there's kind of a mouse pad you think about your chair, like what feels most comfortable for your body. So many of us think we need to follow these formulas for how things should be, but really you have to think about what your nervous system is telling you. Be aware of what your nervous system as an individual is telling you feels best. Even with shoe wear, we used to do this for a long time, where we'd try to give people shoes based on, do they have a high arch or do they have a low arch? And they found in the research that the people who get injured the least are the ones who pick shoes that they just find to be comfortable, not shoes that match to their arch type. So this is true for so many things. Find the thing that you perceive as feeling the best, and that usually means you'll be less likely to develop some of these painful conditions. So think about those places where you spend a lot of time in one position, because those tend to be the things that cause people the most problems when it comes to the musculoskeletal system. Of course, people get injured playing basketball and sports and things like that, but most of the people who come into physical therapy a lot of cases are not athletes. They're just people who are very stuck in one position.
Valuable advice. In fact, my physiotherapist asked me to get a squeezy ball for my fingers, because in karate, when you close your fist and you're holding it tight all the time, so I was getting some pain over here between the knuckles. I don't know what it's called and all, but she asked me to get a squeezy ball, and I actually realized that was so good because it relaxed me, because I would keep tossing it up and down. And you squeeze it, it's got a smiley on it. The other thing that was recommended to me, Dr. Tom, what do you feel about when you have a standing desk and you have one of those skateboards which look like a balance board?
Yeah.
That's so
Yeah.
much of fun,
I
trying
think
to
those
do
are
a
really
Zoom
cool.
call and just like stay in one position.
Totally. Yeah, I think something like that, lots of benefits. Like, there's so many little cool tools out there, but yeah, that kind of skateboard balance tool. I mean, yeah, not only are you working on balance, and you're just incorporating what we were talking about before, where you're introducing different types of stress constantly to your system. It's sort of like I do a lot of trail running and hiking where I live. And so the great thing about an activity like that is you're constantly stepping on different rocks, and it's varying the stress in your system. And I think of that little standing kind of skateboard thing sort of in that way, like you're keeping moving, and it helps vary stress. It's kind of like when people remember, for a while, people at desks are sitting on the big physio balls. They would sit on
Yes,
the ball.
yes,
Same
yes.
kind of concept, right? Like if you sit on a ball like that, you can kind of keep your, like I'm on my little treatment stool right now. Like I can kind of move around and my pelvis can move. And for someone with low back pain, just keeping your pelvis moving helps to keep your spine moving, which moves fluid around in the tissues of the spine, in and out of the intervertebral discs. You're just, again, you're not being sedentary, so you're less likely to trigger these little danger receptors we have, which are called nociceptors. They're little receptors, little nerve endings that send danger messages up our spinal cord to our brain. And if you keep moving regularly, you are less likely to hit the threshold for activation of those nociceptors.
I'm going to deviate from script because you put a thought in my head just now. So I got to move my spine, and I'm thinking about the spine, the disc, and then these shock absorbers, which are the disc or the ligament or cartilage. And I've not studied much about that. So, does blood go directly into a ligament or cartilage? And how important is movement to get some nutrition over there? Because I think my general knowledge says that blood circulation doesn't go into a ligament and cartilage. So, could you expand that for all of us who are not nuanced in this subject?
For sure. It's a great question. I have a whole chapter in my book on stages of healing, and a big part of that boils down to what tissue type you're talking about, how long something takes to heal. Probably the major factor that determines that is how much blood flow goes to that tissue. And so a lot of what we do in physical therapy with exercise is helping to promote blood flow to a tissue through those therapeutic exercises, which ultimately boosts the healing process. It helps to speed up the healing process.
So, sitting at a desk at work, there's no movement, therefore, no blood circulation, therefore, no nutrition to the joint, cartilage, or whatever, bone, or whatever, and therefore, there's a degradation. Is that what you see mostly?
That is honestly kind of the process that's the number one theory for why people develop pain in sedentary or static situations. So if you imagine we're both sitting right now, just imagine if you're sitting and listening to this in your car or wherever you're at, as you're sitting, you are causing compression of structures, especially in your buttock region. There's going to be compression of structures in the pelvic region, in the low back. Those areas that are compressed right now start to become ischemic, meaning they get less blood flow. And so when you have less blood flow, you also become hypoxic, which means less oxygen. You get less nutrients like glucose. And so as that situation stays like that for long periods, low oxygen, low nutrients, eventually it does activate those nociceptors. And that's when we start to feel, ooh, this is uncomfortable. In most cases, your nervous system will just make you move unconsciously. You'll shift in your seat, you'll take pressure off one side of your buttock, you'll shift to your right, you'll shift to your left. You'll just naturally, subconsciously do these things. But that essentially is a lot of what movement is about, especially when we're talking about pain conditions related to sedentary or static positions, is about changing the stress. Like when I was saying changing the stress before, changing the stress is essentially when you change the movement stress, you allow blood to perfuse into different tissues, and that gets nutrients and oxygen there.
Another question out of context. What's this NOS?
Oh yes, it's called a nociceptor. Yeah,
How do you spell that?
it's NOCICEPTOR. Noci. So it's NOCI.
NOC. So what's the function of that? I heard you saying it 2-3 times. So a lot of our audience is very geeky. So they're like, what's that all about? Maybe we give them a little bit of download on that.
Yes, yeah, I love it. I'm a geeky person too. So a nociceptor is essentially you can think of it as a danger receptor. We used to, in the olden days, we used to call these pain receptors, but we've realized now that pain doesn't come from the tissues of the body, it's an output of your brain. So what essentially happens is nociceptors are activated when you stress them enough. So if you imagine I'm pinching my fingers together right now, if you pinch two fingers together, as you start, it just feels like pressure, right? But as you increase the pressure, you eventually can hit a point where it starts to become uncomfortable and maybe where it gets to pain. And so you will eventually, as the pressure increases, you will hit the activation of the nociceptors, those danger receptors in that region. And then they will send afferent, ascending messages into your spinal cord. So if it's in my fingers, it'll go up my arm into my cervical spine, because all those nerve roots go into my neck, into my cervical spine. And then those will go up into different regions in the brain, the sensory cortex, things like that. The brain then kind of weighs all that and decides if I should feel pain to protect me down there. So sometimes you feel pain, sometimes you don't. People can think about this. Like we've all had experiences where we've gotten injured and didn't feel any pain. Like maybe you got a bruise and you notice it the next day and you're like, I have a bruise there. I don't remember anything, nothing ever hurt. So we try to help people understand that tissue injury and pain are different things. Like you can have a tissue injury and not have pain. you can have pain and have no tissue injury. So they're different phenomena, and we really try to help people understand that how different they are. And a lot of this actually came from phantom pain research, like where somebody's lost an arm or a leg and they still have pain in that missing limb, but it's not there anymore. So it really helps you understand that pain doesn't come from the tissues, because some people can have pain in tissues that are no longer there. Like if you lose a part of your leg, you still have pain in that missing leg. You have to start to think, oh, this pain is more complex.
So speaking of pain, I do get a lot of clients that come to my clinic, and whenever they have a simple neck or back issue, I've noticed that it causes daily headaches. And now I've seen some of your videos, and you've talked about without popping pills. You just mentioned it, that the pain receptors go through the cervical area. Expand a little bit. People who have headaches, could it be related to something on the physical part of the body which they can actually treat without popping pills?
Oh, for sure. Yeah. I think most people with headaches of different types, it's very much worth looking at their musculoskeletal system. There is a really close association with headache type symptoms and the neck, the cervical spine, and the TMJ, the jaw joint. So these areas are very closely linked. But probably the area we go to, especially right away when people have headaches, there's even a type of headache called a cervicogenic headache, which means its origin is in the cervical spine. And so those people will usually there are these nerve roots right up at the base of your skull. So if you trace your skull down, there's this region called the suboccipital region. And there are all these little muscles in there and different nerve roots that come out of our neck. And so, if people are in positions, again, maybe we think about that person who sits at a desk. A lot of times when people sit at a desk and they're looking at their computer screen, they will often assume what we call now kind of like the forward head posture. They'll sort of round their shoulders and they'll let their head kind of jut forward, and then they'll lift their chin. And so when you hold that position, I'm kind of demonstrating for people who might be on video, but if you think about, you kind of slouch forwards, you kind of bend forward, but then you have to look at your computer screen, so you have to lift your chin. And so what happens is the neck has two regions. One is the lower cervical spine. So the lower cervical spine in this case is going forward, and then the upper cervical spine is going into extension. That's what allows me to lift my chin. People can think about it as if you're just nodding to someone. If somebody asks you, do you want to go out later? And you're saying yes, that nodding motion comes from the upper cervical spine. So when your chin juts forward, that creates upper cervical extension. And what that does is it tightens the muscles at the base of the skull, the suboccipital muscles, and it can cause some compression of those suboccipital nerves. So just like we talked about before, a lot of pain conditions have to do with a lack of blood flow. So if you put your neck in that position for long periods, you can create sort of some ischemia and cut off blood flow to those suboccipital nerve roots. And that can create this cervicogenic headache it tends to wrap around the side of the head and maybe even into one eye socket.
Wow.
So there's a lot you can do. I think anyone who has headaches, I've posted a lot of times on this because it ends up helping a lot of people. There's a lot you can do by addressing the neck, mobility, and kind of light strengthening exercises of the neck that often helps with headache.
I think that's very important, because there's one thing that people sometimes don't join the dots, is that they believe that popping a medicine can take away the pain, but they're not going to the root cause, which is the proper, posture or even understanding. And the reason I'm doing podcasts with experts like you is to make the world understand that you're like a high-end vehicle. Everyone believes they're a high-end vehicle. I believe I'm a Rolls Royce, right? What's your favorite car?
I have a Porsche 911, so I like
Oh, that's my dream car, the 911. So,
Yes.
okay. So, we all believe we are that, but then we try and take it to our local garage to service it with maybe not that brand of mechanic who understands that vehicle. And so people say, like, I just do an oil change and just clean the car up. I don't need to do anything. In the human body, like a car, you could go out tomorrow and buy another Porsche 911. I could go out and buy another vehicle, another SUV that I want, but we can't change the human body. So I'm constantly encouraging people, figure out your bioindividuality in food, what you eat, figure out your bioindividuality in movement. Because in sports, we are seeing biomechanics plays a massive role. And in India, we're very famous for cricket, and we have some of the best exercise physiologists working on the bowling action, which is very much like your baseball where you throw the ball, and each guy would have a different shoulder throw. And hence it has to be customized, the exercise to such a person. So I think headaches, non movement, pain that happens, the first thing you need to do is not pop a pill, but to address it by going to an expert and having the expert say that, you know what, I think this is the whole thing that you should do. And for temporary management of pain, you probably could take a medication or painkiller under the advice of your medical doctor. But anyway, I wanted to talk to you about I get a little bit of pain in my and a lot of times I get free consultation in these podcasts. So I'm gonna pick your brains on this one, Dr. Tom. My SNC guy was told by the physio that I should extend my hand out like that and
Mhm.
basically stretch the muscles, the tendons, and then they
Mhm.
said the nerves. So,
Mhm.
is this true that nerves can be stretched to a certain extent, or is that a wrong notion, or is that a correct notion? And why is this important? Because we are from the land of yoga, and anyone who's done yoga swears by it after about 6 months of doing it, saying, I feel so good. So, Dr. Tom, nerves, stretching, how important is it in the movement world?
Yeah, it's a great. I focus a lot on nerves because look, all pain is neurogenic at its roots. It comes from your nervous system. So more and more, we're starting to think that a lot of the mobility exercises, especially, and people might have heard of soft tissue mobilizations, kind of massage techniques. More and more, we think about those techniques as one, boosting blood flow, but also affecting our nerves. We have all these nerves. So we have the nerves that come out of our spine, and those nerves join together to form the big nerves, the big peripheral nerves that go down our arms and legs. And so in the physio world, there's been more and more research looking at things called nerve mobilizations. And I cover these a lot on my account. And sometimes they're called nerve flossing, or sometimes you might hear it as like nerve sliders or nerve gliders. But nerves do have a little bit of ability to stretch. They can stretch slightly. But what we actually do in physio when we're addressing nerves is these mobilizations, we're actually trying to get the nerves to slide. So we often make because it's called nerve flossing. So sometimes we'll make the analogy, if you think about kind of sliding piece of floss through your teeth, even though dentists tell me you don't actually slide it, you want to move it up and down through your gums. But that's what our nerves kind of do. And what they do is they take cadavers. So you imagine people who donate their bodies to science. After they pass away, you dissect them. And I've done this on several occasions in physical therapy school. You get to dissect people. And so you can see the nerves. And when you move the person's arm or legs, the nerves slide through these passageways. And so they have to slide, in some cases, a few centimeters. So anywhere from millimeters to centimeters. As you think about when you were extending your arm, you extend your arm out and straighten it out. Depending on which way you rotate your arm, you would be causing the median nerve to slide, which is the nerve that goes through a carpal tunnel. You might be causing the ulnar nerve to slide, which is the one in your funny bone kind of area when you hit your elbow and it hurts. Or it could be the nerve on the back of your forearm and hand, which is the radial nerve. So those big three peripheral nerves go down our arm, and they all have to slide when we move. So these types of mobilizations, more and more, when we're thinking about giving people stretching exercises for pain, we're not just thinking about stretching the muscle, because right, you can make the muscle tendon unit. You can change the muscle tendon unit. Even that is a neurological response. We have muscle spindles and Golgi tendon organs, which are these receptors in our tendons and muscle fibers that you can sort of sensitize or desensitize. And that is some of the thinking now, part of the thinking on maybe why we get more flexible. In high school, I used to be able to do the splits. And I remember I used to spend a lot of time stretching. And so some of that is actually the muscle fiber getting longer, the muscle fiber itself, but some of it is that muscle spindle fiber, which is a muscle fiber wrapped by a nerve. So inside all of our muscles, we have fibers that are wrapped by nerves, and those tell us how stretched out our muscle is. And if our body's not used to being stretched out, it will try to fight it. We've probably all experienced this. When you're new to stretching and you go to try and stretch, sometimes your muscles will fight you and kind of shake. But then as you get more flexible, they'll just kind of let go. And sometimes we feel this, they'll kind of let go and you'll gain more range of motion. And that is thought to be the muscle spindle sort of desensitizing and letting you stretch more. So a lot of this stuff now boils down to the nervous system and thinking about how well do our nerves move and glide? And then also, what's the blood flow like to our nerves? Some of the studies have shown that these nerve mobilizations actually just get more blood. Our nerves have their own microcirculation, so they have their own little blood vessels that go to them. And so if you cut off those blood vessels, you're more likely to have nerve pain. Sometimes you can make these things really complicated, but at the end of the day, sometimes it just boils down to moving. Just move in different ways each day, move around, and it's so good for your movement system.
There's a thought that is going through my head. There are two reasons the movement slows down. One is age, the second is age, meaning one is you're actually aging and the cells are getting older, and therefore you need to pump more circulation, more movement into it, so get more stem cells to come in, even though your stem cells productions keep dropping as you grow older. So I think as you grow older, what you're saying to me is you've got to do that movement to help in that circulation, which will bathe all of these things in nutrition. So what I've understood this far. And the second is, I think as we grow older, we tend to not move out of enjoyment or happiness, and then we need to bring in actually what we call as exercise, which is I go for yoga, I go for Pilates, I go to the gym, I do my stretching, or I go to Tom once or twice a month just to check up on a maintenance that is my arm going back all the way or not. So this is really cool, and I think Dr. Tom, what I'm hearing from you is this, that there's so much of science and there's an intricate science, and the human race is trying to understand the entertainment part of the release in terms of watching TVs and dopamine hits and all of that stuff. But one of the best things that you can do to really feel good is to begin a movement of movement, if you get what I'm trying to say.
As you were talking, I was thinking about kids. Like kids just play a lot. They they go to physical therapy, right? But it's if they maybe have a birth defect or they really had some injury, they broke a bone or they were a gymnast, they're an athlete of some sort and they really injure something. But kids don't come to physical therapy for the things adults come in for. They're not, and maybe this, I'm not a pediatric physical therapist, so this could be changing because more kids are becoming sedentary, right? Like you see more kids sitting and gaming and not being active outside, like maybe some of the younger generations used to. So we may see these numbers change, but for the most part, kids are more likely to just play. And when you play, you move your body in all three planes of motion and you move it. You use all your different muscles. Kids are always like wrestling and they're climbing trees and they're running and jumping. They're doing things just naturally that keep their movement system healthy. So they don't think about so much like we do as adults where we have to intentionally go introduce some form of exercise to move our body, and so I think maybe that's a mindset that you try to think of more as an adult. Like think about how kids just enjoy movement and they just play, and try to find something like that you really enjoy. I'm sitting here talking about these specific therapeutic exercises, but what I really hope for anyone listening is that they'll just find a form of movement that they enjoy. Like you spoke about yoga earlier. I really like going to the gym and lifting weights. Like that's my favorite thing. I like going. Today I did pull-ups. I did like my back day. So I did pull-ups. I did some hamstring curls. I was doing bicep curls and I ran a little bit. So just find the thing. Like maybe you like Pilates. Maybe you like a particular sport. Like maybe you play, football, soccer, or something like that,
Or
or cricket,
dance.
or dance. Dance is an amazing one. Dance is so much. Both of my daughters are dancers. They do hip hop and ballet and jazz and things. So martial arts, like there's so many different things that you just find something you enjoy that's a regular movement practice, and just think about you have this one body. Take on that landlord mentality and think about you've got this one body that you want to keep healthy for your whole life. You don't get a replacement. You can't just go buy a new car like we were talking about earlier. This body's going to go with you. And the more that it's hard for us to imagine now, especially if you're a younger person, it's hard to think about yourself being older and having severe musculoskeletal problems. But all of our bodies, our tissues are going to age, and mobility and strength, those things are going to become, our functional independence is going to be more and more challenged as we age. But the work you do now, those little deposits you make now as a younger person, just trying to come up with those habits where you're making weekly deposits into your movement system, will pay huge dividends when you're an older person. I've worked in nursing homes. Like you see the people who don't take care of themselves, and sometimes people get injured and there's circumstances that happen in life, right? But you see a lot of people in those situations who just didn't take care of their movement system, and then they end up losing their functional independence, and then they're in a facility where they can't take care of themselves and somebody else is taking care of them. So easy for me. I've worked in that setting, so I can imagine it. A lot of people haven't seen that unless they've had a loved one that's gone somewhere like that. But the little movement deposits, the strength and mobility, that's going to help reduce the odds you end up in that situation.
I want to pick your brain on this because a father who's 78. He uses a walking stick, and his muscles are slowly wasting away. Obviously, he walked in his 50s and 60s, but Now we're hearing a lot, Dr. Tom, about muscle. And I remember reading this article saying that muscle is the only age reversal organ. So, why do we lose muscle so quickly when we age? You're talking about the old age homes and a senior therapy and care. Is there a way we can communicate to the younger generation that there is a way to stop or even reverse the aging of muscle or the deterioration of muscle? And how can somebody say that uh, this is the single most important organ in the human body, the muscle?
Luckily, there's been so much more awareness around this, but it's a natural part of aging. From about the age of 25 or 30, we start to, with natural age-related changes, start to lose muscle mass, and it's called sarcopenia. Sarcopenia, a lot of people have heard of osteopenia and osteoporosis, where we lose bone mass. So for a long time, people have thought about their bone, and of course, your bones are important too, but muscle is what allows you to move. Muscles pull on your bones, right? Your muscles attach to tendons, tendons attach to bones, and that's how we move our skeletal system. But our muscles deteriorate. They shrink in mass naturally as we age, and this is this concept of sarcopenia. But you can offset so much of it, and this is why the muscle system is talked about so much in terms of the most important system in terms of reversing aging, because when you incorporate resistance training, which is the thing I'm talking about probably 75% of the time with patients and online. Resistance training is what a lot of people think about as strength training. It's just applying external resistance to your musculoskeletal system and having to overcome that. So you might think about lifting dumbbells or using bands, or you had that squeeze ball earlier, or doing body weight squats. Anything where there's gravity on your system or there's some external tool, when that's applied to your system, and that external force wants to create some movement, your muscles have to resist it. And when your muscles resist in a certain dosage, right, like where you're going to where you're tired, it helps to stimulate those internal processes that help to maintain your muscle mass, right? It all sounds maybe kind of overly scientific, and how does this relate? But it's like, if your muscle mass is maintained, you think back to the fact that when those muscles are healthy, it means it's easier for you to move your bones and joints, which means it's easier to do all the things in life that you want to do, right? Like my mother-in-law is 83, and
I
I
was
see
about to
she has a
ask you, do you have any case study?
Yes, I see this all the time, of course, with patients, but my mother-in-law is on my radar all the time because I see her. She lives 5 minutes away. I see her a lot. I noticed for her, one of her real impairments in terms of her muscle system, specifically in strength, are her hip extensors and her knee extensors. So her glutes and her quads. And this is so true for so many people. Those are the two muscle groups. So your quads straighten your knee and your glutes straighten your hip, right? So, but what they do in function is they help us get us up and down from squatting positions. So like getting in and out of a chair. And this is where so many people, as they age, start to lose some of their functional independence. So in physical therapy, we'll talk about helping somebody with transfers, helping them transfer from a chair to standing, or from standing to a chair, or from one chair to another chair. And you need those muscle groups to do that. And so I noticed with her, she has a very difficult time getting in and out of a chair now. She has a difficult time going up and down stairs, which are those same muscle groups. Sometimes getting in and out of a car, like if it's a car that kind of has a step up, something like that. So I see her muscle system starting to change and how that's impacting her functional level. And as much as I try, I can't get her to incorporate resistance training exercises. She just,
Is it a mindset?
I think, it's a
And
mindset.
it's not your mother-in-law, it's my parents too. They're 79 years of age. I've gotten a physiotherapist to come home. It's taken them
Yeah.
about a year to figure out that there are dumbbells, there's resistance tubing, but like, oh, we're old, we don't need to do this. And so how do we get that for the current older generation who might be watching this, but also people who are in their 40s to 70s, where they can start now with weight training? So mindset or excuse, what is it?
Yeah, I think some of it for the older generations was that resistance and strength training weren't maybe as popular as they are now. I feel more hopeful for the younger generations because I think there's way more people aware. So I think it's education, like education at a base level. Like, why is this important? I think some people think resistance and strength training is just to make you look good, and they don't understand the kind of functional impact. I think that's a big part of it. I think the education, the why, we often talk about in physical therapy. Why am I doing this? Not just, you don't just give somebody some things to do, you explain why that's relevant to them. And so I think hopefully when people listen to something like this, they'll start to understand why particular exercises are relevant to their function and their overall health. But I also think a part you mentioned earlier, when you talked about filling up the water bottle, getting up and going back, I think sometimes for people, exercise for some people feels like homework. And so you have to figure out ways to boost adherence. This is the number one problem in physical therapy, is that you explain what someone needs to do and you give it to them, but they don't do it. And so adherence is very low. And so I think the way to boost adherence, if you don't like these types of exercises, is to integrate them into your day with things you're already having to do. So like when you brush your teeth, do 10 squats. Like just make it a habit. Like I'm going to do 10 squats when I brush my teeth.
I got a
Or
solution to adherence.
yeah, I
You
love it.
go and hire Dr. Tom Walters and make him turn up for you, because that's what I am. I am very lazy. So my coach told me you need to do these stretches, hamstring stretch and all. And he told me for 2 years and I didn't do it. Then finally I got the SNC to come home 3 times a week in the morning just to stretch me out. So there are lazy people like Ryan Fernando, and they need to outsource their
Mhm.
physical therapy, and that's one option. The second is to turn up and do the adherence that the expert is giving you. So you got to figure out your personality actually. So if you're lazy, you
Yeah.
kind of like, I'm not going to do it. So get the expert to work with you. Turn up there like a tuition teacher, like a school principal. You
Yes.
got to do this. And the second
This is
one
why
is,
trainers and strength and conditioning specialists are so helpful, right? Like the big part of it is not, of course, the workout's great, but a lot of it's the accountability. You know that person's there waiting for you, and then you go work out. So you can hire a physio to do things like this. You could hire a trainer. Like, yeah, or there's even apps now. There are like accountability apps. You could just have a friend who's your accountability partner. Like, we're both going to work on
that's a
this
brilliant
together.
idea. Friends turn up
Yeah,
for each other.
exactly.
Is there any 80-year-old or 70-year-old or 90-year-old that wowed you because you started them on physical therapy and after 2 or 3 years you were like, whoa?
Oh yeah, I have a guy I'm going to see tomorrow. I've been working with him for 14 years, and he's 78, and he is the most disciplined. There's no issue with adherence. He will do anything that I ask him to do, but he has multiple sclerosis, and so he has a disease that it mostly affects his right side, especially his right leg. And so he sees that if I lose my health of my movement system, I can't walk anymore. And it's scary, right? When you have a real health concern, health becomes your number one goal. So many people listening don't have a major health concern, so they aren't that worried about it. So we're lazier about incorporating things like this when we don't have a real problem that negatively affects our function. But in his situation, he recognizes that if he does the exercises, he's more likely to keep walking. And so he's so good. He does everything I ask him to. And I don't give him too much because I recognize he has other things in his life, but I try to give people the right amount that works for them. But he's so disciplined and he always surprises me. And I always tell him, I'm like, if everybody was like you, my job would be so much easier.
And are there any data points that you track with this elderly gentleman over the last 14 years in terms of muscle mass, fat mass? Does that help you out?
Yeah, yes. Like you said before, people love data. Even the non-science people, we all like to see progress and things change, you know? So for him, most of it is tracking on his right leg. We track the circumference. So we do look kind of at muscle mass. We look at the circumference of his thigh and his lower leg, sort of his calf and tibialis region. So we track that. And then one of the easiest things for people is just to look at, that's what's great about weightlifting. You can look at the weight you're lifting and track it over time. And so it's a great objective measure. He doesn't have any mobility restrictions. So some people I'll measure their joint range of motion and we'll track that over time. But for him, it's mostly looking at how is his strength changing over the years and his muscle mass. And with multiple sclerosis, in his case, a lot of it is it's difficult to really gain a lot of strength in that situation. So a lot of it is just, can we maintain? And 14 years, there are different types of MS, but with his particular type, he's been able to he's pretty much stayed at the same functional level the whole time I've known him. So
two tips for this wonderful person that you're working with. Latest research is coming out. There is a bacteria in the microbiome testing that activates MS. So you might want to research that. The microbiome testing, changing the gut microflora. There are certain
okay.
bacteria which lower the pain condition. So it starts in the digestion system. There's a blood test in America from Geneva Diagnostics that you could do, and it'll give
Okay.
you your neurotransmitters, it'll give you your omega-3 deficiencies, your amino acid deficiencies. And the other one that you could do is, and there is an algae from your country called Klamath algae. And in stem cell research, it's the only natural compound known to boost stem cells by 25%. So I'm
Wow.
giving away one of my secrets
I,
away for this gentleman who's working with you. And check out his gut comfort to this algae type spirulina, Klamath algae, and maybe 4 capsules a day as a nutritional aid to help him in his stem cells. that when you're doing occupational therapy, which breaks down muscles to rejuvenate the muscle for the next day.
It's so interesting you say that because he developed this after going to Africa and getting sick. So he developed multiple sclerosis after getting sick on a trip to Africa. And so there was some sort of auto-inflammatory process that was activated, but it makes me wonder what you're talking about there with the bacteria and the microbiome.
So whenever somebody, Tom, has a pain condition and they ask me, how will diet help? I always say from two perspectives. One is in cellular rejuvenation. So you got to give the right nutrients. So genetically, are you deficient in certain things? So for example, assume this guy does the genetic testing and he discovers that his collagen absorption gene is lowered. So now you're thinking, I need to supplement with collagen. And then you match that with his liver enzymes and his kidney function test and see whether he can take 10 grams of collagen a day or it's split up. The second part to the cellular integration of good nutrition is the molecules that are going in and slapping your body, which could be gluten. I've written a book called Wheatless, and I'm going to send it across to you in the US, where I have taken 20 years of experience testing people with the genetic test and the blood test. And they have all of these autoimmune issues for years. And the moment I convince them for 1 year to reduce the gluten intake or the dairy intake, which is lactose intolerance, and then I do the food intolerance blood test report. Like I am allergic to peanuts, and I never knew I was allergic to peanuts. Nothing used to happen to me. When I did the test, I started eating peanuts. I just realized I get more gas. But the inflammation in my joints when doing karate, the day I take peanuts 2-3 days in a row, and it could be something as simple as a Snicker bar, I can feel it when I'm gripping my punch. And then when there's no peanuts for 20 days, it's like, whoa, this is amazing.
Yeah.
So is it Ryan Fernando's start of an autoimmune disorder, osteoarthritis, autoimmune arthritis, or Ryan's eating the wrong foods and it's slapping his body, higher inflammation, and he's accelerating his condition forward? So there's a lot that we can do for our pain patients from a physical therapy point of view, but I'm planting the pole for nutrition globally, saying that it is in your food. Start also with your food.
I totally believe you. I think the nutrition side is an area that I'm so excited for the advancements and the things you're talking about already, just looking at genetic testing. And I was talking earlier about how the multidimensional nature of pain, and especially when we look at chronic pain, we think a lot about systemic inflammation, and right. And we know nutrition, metabolic disorders, all these things contribute to systemic inflammation. So I really believe you. I think that for a lot of people, that is a huge component, especially with how bad Western diets are getting. I mean, they're just so pro-inflammatory. I think I would imagine it's a huge component in a lot of people.
I think when you talk about pro-inflammatory diets, I think the world has gotten much more busier. If you talk to our grandparents, they knew what boredom was. They would just sit around somewhere and be bored. We aren't. We always go, 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 go. WhatsApp this, Netflix that, order this, Uber Eats in. And preparation of food has gone into packets. I have seen this personally in my clinical practice. The most chronic cases, the most deathbed cases. I'm talking of people with a grade 3 fatty liver, liver transplant due, cancer. We have an oncology team at my coordination clinics, and people have given 3 months to live and they end up still being alive 2 years later. The cancer is there, but they're controlling it because they've figured out their baseline level of what not to eat and what to eat. But let's come back to you on muscles, because whilst you have a 78-year-old, I am 50 years old. And sometimes when I turn in the bed, or I go for a cold shower, I do a lot of cold shower. I suddenly pull a muscle or catch a muscle without any movement. Now, Tom, what is that? Is it old age?
Yeah. Yeah. First of all, I can't believe you're 50. You look amazing for 50. You're doing great. The physiology that happens, you don't have to be older for that to happen, but you definitely hear it more in people as they age. And I don't know that we really know the physiology underpinning some of those experiences. I think that, I would imagine we know as we age, right? And you know this better than I do, but the changes in collagen and the changes we were just talking about in the muscle fibers and in our nervous system. And I think sometimes when people get these little tweaks, like they aren't doing something stressful, they roll over in bed or they shift a little bit and something kind of feels like it catches and grabs. I think it can be due potentially to a number of different tissues. It could be, a muscle, maybe that muscle spindle thing we were talking about earlier, the muscle fiber that's wrapped by the nerve. Maybe you move in kind of a funky way and your system's not ready for it. And when that happens, the muscle will kind of contract, almost like a muscle spasm. Like when people think about a muscle spasming or guarding, I think that happens to a lot of patients that come in and see me where they're sleeping and they move funny or they sleep funny and now their neck is really locked up and stiff and their muscles are really guarded. So it could be some kind of movement like that that triggers something in the muscle. Thinking about the collagen, I do think as collagen declines as we get older, it probably contributes to some of the mobility problems. You know, a lot of older people just they feel stiffer, right? They feel stiffer. They tend to have their range of motion in a lot of cases. It's harder for them to move through full mobility. And they will often say when they get out of bed in the morning that it takes a little while to limber back up and kind of like get the oil back in the joints. So our tendons and ligaments and the joint capsule is kind of like this balloon structure that surrounds all of our synovial joints, like all of our big joints, our shoulder, our knee, our hip. They have this big joint capsule that kind of holds the two bones together. That joint capsule is mostly collagen. So, you know, I think sometimes when people feel these little tweaky kind of things or what you're talking about, I sometimes wonder if it's related to some of these collagen changes in our connective tissue structures associated with the aging process. But again, that's where prehab comes in, right? That's like where these drills come in, because for sure the people who regularly implement movement, and it's a fine line, right? Movement is there's a dosage to exercise and movement just like there is to medication. And so any exercise or movement can be good for you in the correct dosage. If you overdo it, which is a lot of people where I live, they're runners or trail runners or they're swimmers, and that's the only activity they do. And it's great that they're exercising, but they often overdo it because they want to run a triathlon or they want to compete in a triathlon. And so they're just doing high volume exercise, and that ends up creating another whole set of problems. So there's always this kind of dosage component to movement that we're trying to help people understand. And it's a moving target. So it's tricky. It has to do with how trained you are. Like if you're somebody already who's really trained in your system and you exercise a lot, your ability to tolerate more stress and movement is going to be higher than that person who's kind of sedentary and doesn't move a lot. So it's a tricky thing. Movement exercise has this dosage. And that's important for people to think about. Like you can't get frustrated. It's a trial and error process. And you have to kind of keep testing your system and kind of thinking about it like an experiment, like I was saying earlier, and finding what's right for your particular system. But the prehab exercises definitely can help with, like, you know, when you work on mobility and strength, you're less likely to have those little things that tweak you.
And I also think that sometimes my physio and my SNC, they sometimes say that, you know, you got to do less, you got to rest, so you get people on both ends of the spectrum, people who don't do and people who do too much, and you got to figure that out with your age. And
Yes.
I want to let the world know that, you know, I have a karate instructor. I have his brother coming in who's an SNC to stretch me in the morning 3 times a week. Then I have my SNC coach who I train with 3 times a week, heavyweight training. Then I have a chiropractor I go to twice a month. I go to my physiotherapist for dry needling every week. And I honestly have greater range of motion in all of this. And then I have a biomechanics specialist to analyze it. Now I have these 6 people, and I don't have a German luxury car because I can always pick up the German luxury car, but I can't change Ryan Fernando's body. And the perspective over here is these 5 or 6 people. Oh, I'm so sorry, I forgot. I have a masseur also who comes home
Okay.
once a week, deep
Yeah.
tissue massage and all. And I'm sharing this with the world is because we spend so much on things that are not an ROI on you feeling good as you grow older. And the experts, no matter how educated or how aware you are, really bring in that fine tweaks into making you pain free in one perspective and feel years younger. And that's something I genuinely believe, Tom. If I was in the US, you would be one of my confidants and consultants. Um, why I'm saying in the US, because I'm too lazy to even take your advice on my. I'm like, yeah, I listen to you, and then I'll be fast asleep on that couch doing my mobility. But you were talking about runners, so I want to come back again. I get a lot of runners here in India. Bangalore has the most number of marathons, mini marathons, half marathons that happen in this part of the world. Techie guys, right? Saturday, Sundays off. So what do? We go run. Varicose veins.
Mm.
Talk to me a little bit about this, because they come in, Mr. Fernando, is there any diet for varicose veins? And I'm like, I don't know much about this. I know horse chestnut works, better blood circulation, vasodilation, too much of sugars in the diet. Let's check the HbA1c. But from a physical therapy point of view, Dr. Tom's, some wisdom.
Yeah, it's varicose veins are one that actually comes up a lot that especially online people ask me about. It's kind of interesting in physical therapy, it's actually not something we treat really a whole lot. So it's we're usually it's one of those clinical conditions that if it seems like there would be a differential diagnosis process, right? If somebody comes in with pain and say it's in their calf region, say it's in their lower leg, of course I don't know where that pain is coming from. So there are lots of different potential sort of like pain generators, we would call it. So we would go through and look as the rehabilitation provider, I'm looking to see is this pain, does it seem to be due to something in their mechanical system, like in their musculoskeletal system? And so if I go through and do all my testing, say I do mobility testing, I do functional testing, I do strength testing, I palpate and look, and if I can't reproduce it with a majority of, some things won't reproduce pain for people even when they have mechanical pain, but I'm looking to see, can I reproduce their symptoms? That's what we're trying to do in the evaluation. Can I reproduce their familiar symptoms? And if I can do that, then I can be a little more certain about what tissue's causing their pain. Varicose veins are one of those ones that there aren't going to be as many mechanical stressors that reproduce those symptoms. And so when people ask me about this, I in most cases will refer them to a medical doctor who is a more of a vascular specialist, because there may be interventions in the physical therapy world because, varicose veins definitely have a mechanical component to them. People who are in gravity dependent positions for a long time where there's a lot of stress on their vasculature. I think in that case, probably aerobic exercise, things like that, like where they're, and maybe changing position, like we talked about before. Like I know my grandma had varicose veins and she was a nurse and she stood all day as a nurse in the hospital, just stood statically. She was just always in that position, and that is stressful on your vasculature over the years. And so, but I do feel like I often will refer those people because I feel like I'm kind of outside my exact scope with
I
that
hear
type of
you. I
pain.
hear you. I get you. Yeah, my granny also, she was a nurse and she had vascular problems. Yeah, it does echo. Staying in that department because varicose veins mostly come at the lower part of the body, and I wanted to talk to you about footwear. And there's a lot of debate online about keeping the right footwear on your feet, and that's where your feet get aligned and pain free. And I'm a huge believer of this. For me personally, about 5 years ago, I discovered the individual fingers in the shoe, the five finger shoes, and
Yep.
I own 12 pairs. I actually wear a suit with the five finger shoes because I just don't care what people think about it. Even I've been thrown out of a nightclub because I was wearing so-called sneakers. They were not those pointed shoes. I was told that comfortable footwear that is aligned to my body is going to remove 90% of my pain in my feet in the future. So is there any truth to this, and what is your recommendation?
Yeah, I think shoe wear is definitely something you want to think about. We sometimes, your body is a kinetic chain. All these forces go through your body, and in most cases, it starts at your feet. And so, thinking about the strength of your feet, the mobility of your feet, the overall health of your feet is going to influence how force travels up your body, up to your knee, up to your hip, into your spine. And sometimes with shoes, sometimes we just grab shoes that look stylish and we don't really think about how they affect this part of our body. It's interesting. It's like that's more the priority for people is how good something looks or is it
Is it more
popular?
in
And
women that you see?
I think so. I think there's definitely guys I'm in Southern California. A lot of guys care about, I mean, I care about how cool my shoes are, but I think with guys, it's a little bit easier. The cool shoes are usually not as detrimental to the feet as they are with females. I think with females with all these high heels and just some of the shoe wear that females will are sort of socially acceptable to sort of look fancy or be cool. They're often harder on their feet in terms of just the mechanical stresses. But I think a big part of it, like I talked about earlier, is finding shoe wear that if you just think about being comfortable first, you'll usually avoid a lot of the bad things. Like you were talking about the five finger shoes, there's a lot of focus right now on shoes with a wide toe box because we don't want to compress the toes together and increase the likelihood that we develop bunions or things like that. So a shoe that's very narrow in the toe box is probably going to be uncomfortable. It's kind of compressing your toes together and that's not going to feel that good. So it's kind of a no-brainer. Just try to choose a shoe that feels more comfortable and doesn't do that. If there's a shoe that has a little bit more cushion to it, like maybe you're a person who is prone to Achilles tendon issues, a shoe that has has a little bit more of a heel support will kind of lift your heel and put your ankle in plantar flexion. That takes a little stress off your Achilles tendon. So there's different things. I think it's another example where there's not a one size fits all formula that I can say to everyone. It kind of has to be based on a little bit on kind of your type of foot, but there are certain things where it's like just try to think about making it comfortable. And an example where you could go see a physio. There are foot and ankle specialist physios who can help you choose shoes. Some shoe stores will help you kind of choose shoes out if you have certain preferences. You have to be careful because sometimes they'll tell you things that are harmful that aren't really true. They'll say like the opposite of what I'm saying, and then you'll freak out. So you have to be careful. You have to take people's advice. Just be careful with what you take in. But I think at the end of the day, try to find something that's comfortable and doesn't compromise, that doesn't compromise your foot in some way.
That equivalent was you walk into a supplement store and they tell you this supplement is really good for you. You want to use this supplement. I get a lot of my clients come in, Ryan, they told me that this is really good. Creatine is really good. I'm like, yeah, creatine is really good for the brain and the muscles, but you have high uric acid and you have a kidney problem and you can't take this right now. So I get where you say that the shoe store might push something that is really detrimental to the client, and which is why experts like you and experts like me, when we have clinical practices and we're not, people meet me in Bangalore airport and say, oh, you're a YouTube influencer. I'm not a YouTube influencer. I'm a sports nutritionist. And I just happen to come onto YouTube and influence the world. And I think that's very important for people to understand that Dr. Tom Walters here is a rehab expert, is a medical practitioner. So sticking with getting wider shoes for the girls, sometimes think about your comfort. Maybe you could go dancing once, twice a week in those beautiful shoes. But the rest of the time, especially I have very young staff on my media team, I've actually given them comfy slippers. I said, wear this in the office. Come in your beautiful shoes, but in the office, trot around with these fluffy slippers and everything. It's important to have comfort. But Dr. Tom, I think that's a message that I will share. I'll cut a clip out of this and I'll push it across to a lot of people saying, buy comfortable footwear, see what works for you.
It's so huge. I love that you do that with the slippers. That's cool.
So, Dr. Tom, when I get injured, in the olden days, like I'm talking about 30 years ago, hot water, a hot bag. Then about 20 years ago, it was ice packs, or put we have some Ayurveda remedies in India of certain herbs, you'll put it on it. When do we know it's time to skip this, do it yourself, and go see a doctor right away?
There are many injuries and pain issues that you can manage on your own, but it can be sometimes tricky to determine when you go actually see a rehab or medical provider. Usually we will talk about things that we call sort of like red flags, things that we would look at with people that point towards something a little more serious, and when we would tell them to go see someone. And so I think one of the things for people to think about is if you've had something traumatic happen to your body, where like something high force, like a car accident or a sports accident, and something really hurt instantly, or you heard a sound like something popped or something. Those are usually cases when I would say, go have someone look at it, because especially if it's in like the spine, or you're in a car accident, or you twist your knee and you hear a pop, or your ankle pops, you just go and put ice or heat on it, or try to do a few exercises you learn on YouTube. You could run an issue. I've seen this happen with people. I talked to someone recently who thought they sprained their ankle, and it turned out they had ruptured their Achilles tendon, and they were just trying to figure out some things to do for an ankle sprain and put some ice on it. And, it wasn't getting better, and they couldn't walk normally. And it turned out they completely ruptured their Achilles tendon. So I think that's probably one of the biggest ones to me is, did something kind of traumatic happen to your body where it hurt right away, or it did something where you're not moving normally, like you can't walk normally, or something feels off. If you feel suspicious, that's a good case to go in. And then also maybe the other one is if you have pain that's lasting, it's not getting better, it's staying the same, or it's getting worse, those, because there are lots of, internal bodily things that can cause pain that seems like physical musculoskeletal pain, where like the kidneys refer to the low back, or people often hear about like heart conditions and where they refer into the arm and neck. And so if something has lasted for a little while and doesn't seem to be getting better with, mechanical interventions like movement, rest, things like that, then that's another good reason to go see someone.
That's brilliant. And in fact, in this part of the world where we live, it's quite easy for me to contact my family doctor, and he can just write a prescription on WhatsApp, and we can actually walk into a diagnostic center or a local hospital and get an X-ray or an MRI done very, very
Mhm.
quickly. So
Yeah.
I would advise people that, sometimes the cost of delay and can actually cause an injury that is really, really high up over there. Doctor, I want to talk about, everyone is told to exercise. And I always tell the clients that come to my clinic, you've got to exercise. But everyone tries sometimes to download YouTube workouts or try and do an online workout. Um, I believe that workout should be bio individualized. Like my push
Mm.
ups look completely different from my trainer's push ups because some of my muscles are weaker. So, do we need to personalize exercise for everybody or follow standard protocols?
Everyone's anatomy will vary slightly, and so that means their biomechanics are going to vary slightly. I think in the vast majority of cases, most people, if they're doing exercises that don't apply extreme load to their system, so this is where biomechanics is relevant. Biomechanics is sort of thinking about the forces on your muscle, your movement system, the forces on your musculoskeletal system. If you're doing things that are body weight in nature, that's going to be more forgiving, right? So the push up is a great example. For most people, if you show them a video of kind of a standard push up and they can adopt that, probably 80 to 90% of people will be okay. But you will have some people, maybe they're brand new to that exercise and it's just too stressful, right? Like that isn't the right level for them. Or maybe there's someone where their anatomy is slightly different and they need to have someone kind of help figure out a better starting position for them. And that's where the form, like your exercise form is really important. And so, like I was saying before, you can get away with little errors in your form more so if it's just your body weight. But as you start to add weight, say you start to use weights like dumbbells or a barbell, things like that, that's where form becomes more and more important and where it is really helpful to have a coach who knows kinesiology and biomechanics and can look at you and see, like squatting is a perfect example. A lot of us have different types of our hip, our pelvic shape is different. So we'll have, right, your hip joint is a ball and socket. Your femur has a head, the femoral head, and that goes into the acetabulum, which is the socket on your pelvis. We can have different orientations of that socket. And so for a long time, everyone was kind of taught to squat with their feet shoulder width apart, pointed forward. And for a lot of people, that's very uncomfortable in their hip joint. They'll get sort of hip impingement symptoms where it hurts in the front of their hip joint. And so we've found over the years that it kind of goes back to being comfortable. Like I said before, some people need to do a wider stance or they need to externally rotate their femurs and kind of turn their toes out to squat and be comfortable. So this is where the nuance of anatomy and biomechanics matters. And I think, like you've talked about before, especially if you're just getting started with things, go hire a good trainer or a physio who's well versed in strength and conditioning, or a good strength and conditioning coach. Just find someone who can help get you going and build a program and teach you good form based on your current training status and your unique musculoskeletal system. It's going to be huge. And then that's your foundation you use as you go forward.
I like that word that you use, your foundation, because a lot of people, I mean, like you take in India, for example, they don't teach the correct posture, the correct exercise methodologies in school. And there are certain schools in America I've seen, you all learn gym class and learn how to squat correctly in your 13 to 16 years of age. What am I getting over here? Is that with the awareness of the internet, people between the ages of 20 to 50 who have never worked out begin to work out, assume they're their PhDs in exercise already, but they don't have any formal ABCD or 1, 2, 3, 4 training in exercise. And they go and start doing things, and everyone believes they're James Bond when they first start exercising because they look at people in the gym or in the Pilates studio and try and push themselves, and then they break the body. So, the message I think that I have heard from you, doctor, is this: get a foundation with an expert, learn. And I believe, from what I've been learning for the last decade, if you're lazy, keep the experts with you far longer than you require. But if you're a disciplined person, I genuinely think 3 to 6 months with a great physio trainer or an SNC
Mhm.
trainer or an exercise physiologist with biomechanics experience, or just get the whole team together and take them
Mhm.
out to dinner and talk about your human body. And my team, when they get together, it's like, there's no problem with Ryan Fernando. He's just a diva. He doesn't want to exercise.
Exactly.
So then I
I
get
love
then I
it.
get really bashed up by all of them. Then I get back into work and like one guy's fed off the other guy's like, okay, I know that you're not doing your squats, you need to do
Hmm.
this. But jokes apart, a lot of us will exercise, Dr. Walters, and then we go on vacations and then we may not come back. So we have starter problems. So, in your experience, you said you dissected cadavers, so you know what different age profile cadavers look like, which is the dead bodies, and you did the medical dissection on them. So, when we take a break from exercise, when do we start losing it? When we start losing the benefits of exercise in terms of muscle endurance, the lung capacity, and stamina. So, your expert opinion on this?
Oh, within a week, within
Just a
a
week.
few days. Oh, it's super fast. There are studies on this. If you take people, one of the great studies are bed rest type studies where people are in the hospital and they're on. Now that's a severe situation, right? We're on complete bed rest, but people start to atrophy immediately. Your system is not going to waste energy maintaining bone and muscle mass, right? This is a huge problem for astronauts. They're always trying to figure out how to maintain muscle mass and bone mass in anti-gravity environments, and so exercise physiologists work on that. But this is true also in bed rest. You need that stress on your system regularly to maintain the health of the system. And if you aren't going, it's that whole use it or lose it, right? It's the use it or lose it type idea. So it happens very quickly. I notice it all the time. I was just gone. I was out of town for 9 days and I did not do my normal strengthening routine. I came back yesterday. I returned to weightlifting and I did my normal back squats with my normal weight. I am so sore today, like so sore. And it was only a week off. So there are good things about having time off like that sometimes, right? Like we in the strengthening conditioning world, we sometimes talk about deloading, like if you're lifting heavy all the time and working hard, sometimes you need a deload kind of period where you just let the system recover. But your system, like I said, your body's physiologically is not going to waste a lot of energy maintaining muscle mass and bone mass that you don't need if you aren't regularly applying that stress. It's just a waste of energy, to maintain muscle mass you don't need. So, people who are not very trained, they may not notice a difference. But if you're someone who exercises regularly and trains regularly, you will notice the changes within a week or two. And a lot of it's, some of it's at the muscle level, some of it's within the nervous system, but the nice thing is you bounce back quickly. If you're someone who trains regularly, you will bounce back really quickly within just a couple of days. But it does make you really aware of how fast it starts to go away when you're not,
And an
regularly
extension to
exercising.
that question, lazy Ryan Fernando, what's the minimum amount of workouts he should do in a week and what duration to get a health benefit and maybe a longevity benefit?
Okay, so if you're looking at there are different types of frequencies you could look at. You could look at sort of just maintaining what you have or trying to actually, I think if we're trying to gain a little bit and really promote longevity, I would say the minimum is probably 2. But I'd rather have people do 3, maybe 4 strengthening sessions a week, but I would say probably 3. I think for most people, if they could get in 3 strengthening sessions a week, and it's not that hard, it doesn't have to be, it's not that complicated, is what I mean to say. It doesn't have to be really complicated. You can think about your body in sort of different regions. Like you have pushing muscle groups and you have pulling muscle groups. So a lot of people will be aware, like pushing muscle groups in my upper body would be like my chest and triceps, things that would allow me to do push-ups, bench press, things like that. And then I have pulling muscle groups like my lats and my back and my biceps, so things that we're doing rows and pull-ups and things. And the same is true on your lower body. Your pushing muscles are your quads and glutes, the things that allow you to jump and get out of a chair. Then you've got things like your hamstrings on the back of your thigh that are more the kind of bending and pulling muscle groups. You could just pick a few exercises, maybe 3 times a week. You go in and you have 30 minutes of strengthening exercise, just at a base level, just like 30 minutes that you just have a little selection of like 10 different exercises and you pick 3 or 4 out of that list and you do them 3 or 4 times a week. At a base level, if you just want to maintain, probably once a week, like just once. Some studies will show this, like just 1 set per muscle group. 1 set per muscle group can kind of maintain where you're at. But if you really want to get ahead and try to make some positive changes in your system, get stronger, then I think you're looking at more like that 2 to 3 times a week.
Wonderful advice, Dr. Tom. In fact, a lot of the lifestyle clients who come to me who don't actually work out, and then I encourage the nutrition plan to have an exercise plan. And then I provide them with a trainer and, we set goals for them. The one thing that motivates them is I ask them to do their DEXA scan once a year, which is their visceral fat surface area, the percentage of body fat, and then they have the muscle percentage. Then I asked them to pick up a very inexpensive $200 weighing scale, which will give the body fat percentage and the muscle percentage. And then I tell them, send me a measurement every 10 days. They're like, but it's not that accurate. I said, I have the accurate one, and we'll use this as the trend line for you to follow your exercise plan and see the result, follow your nutrition plan and see the result. And we actually see that they themselves begin to work out, oh, after a 1 year period, what is the best stat for their body, because they have understood their trend line. Like, so there was one client that came to me and says, you know what, if I get 3 workouts of heavy training and I do yoga 4 times a week, I'm in perfect health and my body fat percentage is lesser than last year. So he's very
Mhm.
happy you know
Yep.
but then many clients want a speed workout. They just want to like get in 20 minutes, get it done. And so at the end of the day, I always tell people out there, find the expert, talk to the expert, ask the expert to give you consultation. If you're living in your body as a tenant, then you'll try and get a contractor that is giving you the worst possible advice and you're trying to skimp on costs. But if you're the landlord of your house, you'll go and find the best contractor or renovation expert for that house of yours. And I think that's where the experts in exercise, in medicine, in nutrition, in sleep, in mind coaching are so important for better health. Now, speaking of quick fixes, everyone wants quick fixes. Doc, I have a few rapid fires before I let you go. I know you have a busy day
Yep.
in California, and I just want to pick your brains very quickly. If you had to bust one posture myth right now for everyone listening, what would it be?
It's what we talked about before. There are no bad postures. Bad posture is any posture you're in for too long. That's bad posture.
What's one simple mobilization or movement that everyone listening can do every single day to stay pain free?
My favorite would be simple mobilizations around the nerves we talked about before. So, one simple one you can do, say you sit at a desk or you stand at a desk, is just to put your arm out to the side, like we talked about before, and sort of just stretch your arm out, almost like people know, like the jumping jack exercise. Kind of think about just moving your arms out to the side. That's an even easier one. Kind of going through, we call them angels in physical therapy. Like, I grew up in a place with snow and we'd lay on the ground and do snow angels. So it's kind of that movement, but just moving your arms overhead and back down, kind of going through the jumping jack motion helps to mobilize those big peripheral nerves that go down your arm. And that's a very simple one you can do whether you're sitting or standing, just to help bring blood and nutrients to those nerves.
Ice or heat, what's actually better for pain?
They both have research to reduce pain. So I probably nowadays lean a little more towards heat because we have some early research showing that in injuries, ice may delay the healing process. The inflammatory process is the first stage of healing. And so in injuries, if you can get away with it, I try to avoid ice. But if you only have pain, then just choose what works best for you. Some people respond better to heat, some respond better to ice.
I think bio-individual is the name of the game now. Figure out what works for you. N
Yes.
is equal to 1 in a scientific study. You are
Yes.
the one scientific study that you need to figure out for yourself.
So true.
Morning workouts or night workouts? Your opinion, which is better?
Morning workouts. I think morning workouts are better in terms of getting your energy up, getting you ready for the day. I think night workouts have the potential of interfering negatively with sleep.
The one posture mistake you see every day?
The one posture mistake?
The phone?
Yeah, probably the one posture mistake is people being in that rounded forward head position, looking at their technology for too long. Not that that posture necessarily is bad. If you only did it for a second, it's not bad, but people are spending hours there.
I see my son hunched over his phone for a lot of period of time. So I was like, why don't you screencast it or send it to the larger screen and watch it over there? So
Exactly.
that's the advice that was given to me by my physios. It's like, don't work on your phone, put it onto your computer and work over there so you're looking at it straight. Dr. Tom, I love foam rolling. Game changer or overhyped?
Overhyped, mostly overhyped. I prescribe foam rolling. We call them soft tissue mobilizations. They can be helpful, kind of like massage for temporarily reducing pain, but way too many people spend way too much time foam rolling when really it'd be better just to get to active mobility and strengthening exercises.
So Dr. Tom says active mobility and strength training is the king. If you were a king with ministers of walking, the minister of dancing, minister of Pilates, minister of yoga, minister of the gym, and minister of homemaking or daily chores, which minister would you give more time as a king for the healthier body?
That is a good question. I would say the minister of strength. Yes, in my world, like we talked about, resistance and strength training, building muscle mass for the movement system is the most important for longevity. So I would want the minister of strength to get more time.
And I tend to agree with you because I do a lot of strength training. And because I strength train, I've realized that it lets me know that as I'm growing a muscle more than last year, looking at my DEXA scan, that Ryan, you need to stretch this muscle. So then it's the first primary minister. So then the other ones fall into place because the muscle is demanding the movement or the circulation or the mobility or the massage or the foam rolling. Wow, this has been amazing, Dr. Tom. Dr. Tom, if people want to reach out to you, I know you have an amazing YouTube channel. Could you tell us how we can reach out to you? And a lot of my Indian clients do travel to California. So if they want to reach out to you and have a private one on one session, how can they find you?
Yeah, well, on social media, I try to answer questions, comments. I would say it's at Rehab Science, both on YouTube and Instagram. So if people want to DM me, I try to answer those DMs. And then, of course, if there's a question, a YouTube comment, something like that's a good place. And then if people want to come see me for an actual in-person session here in California, I would say either again DM me on Instagram or email me. It's tom@rehabscience.com. So either of those, if people want to reach out. And also on my website, rehabscience.com, there is a contact area. There's a contact box, but social media, DM, and email are the best.
I'm going to put the link in the descriptor on this podcast for all your fans and my fans if they ever want to reach out to you. And before I let you go, Tom, are there any questions you want to ask me about nutrition or diet?
Oh my goodness. I am a side nutrition geek. So there's a lot of things I could ask you. That was actually my minor in university. Was I was an exercise science major, but nutrition, I've always been very interested in nutrition from both a performance and a health perspective. I think my question to you maybe on the topic of pain would be, you kind of alluded to this earlier, but what would be the things, and I would imagine there's a lot, so maybe this is too broad of a question, but when you think about pain and someone having ongoing, maybe kind of chronic pain, what would pop into your mind first, or what would you want to look at from a nutrition standpoint?
So I try and behave like Sherlock Holmes, thinking that I can solve
Mm.
this crime of pain. So I look at my department of nutrition, which is very clear. Do a diagnostic test. What are we looking for? Let's look for inflammatory markers, C reactive protein, HSCRP, that's the high C reactive protein. I look at ESR, the erythrocyte sedimentation rate. I also look at homocysteine, which now, although it's a cardiac marker, it's also a great sign of inflammation. So
Mm.
these are the what I call as the somebody's taken a baton and going full on inside your body. So look at those inflammatory markers. Then I look at could in my department of nutrition some of the foods be the culprits that is really what I call as bashing up the body. So for
Mhm.
example, I had this one client who had severe migraines, and when I stopped gluten because the DNA test came back as gluten sensitive, but her blood test, food intolerance test, did not show gluten sensitivity, which was
Mm.
very interesting. I said, ma'am,
Yeah.
90 days, just stop it. Migraines of 30 years just disappeared. How do you
Wow.
explain that? So there could have been something which I think as science, we're slowly discovering the ability to find these issues. But sometimes the simple process of elimination in nutrition and doing keeping a food diary really helps. And then the third department in the diagnostics is looking at nutritional deficiency. And Tom, you would know this since nutrition was your major um, love, which is look at magnesium. Tight muscles, pain could be
Mm.
higher. Look at dehydration. So there are certain weighing scales which measure intracellular and extracellular water. So sometimes people are drinking a lot of water, but the hydration, both in terms of pH, in terms of the electrolytic balance, because in India we use a lot of reverse osmosis filters which strip the water of the electrolytes. So the
Mhm.
sodium, potassium, chloride, and magnesium balance is off, and that dehydrates the body without people even knowing it, and therefore the pain receptors could be just hangry. They're not getting
Mhm.
enough of bathing of fluids. And you and I both know that the best friend of water is vitamins, minerals, amino acids, and everything that carries it to those uh, places
Exactly.
for rejuvenation. And if rejuvenation is not happening, then the body is going to send those pain signals. And then the final point would be just basically figuring out if my client is working in excess calories or deficient
Yes.
calories.
Yes.
The world is eating too
Yep.
much today.
I couldn't agree more. Yes.
And
Yeah,
then
this is
I
such
go
a
to,
focus that you hear. You hear so much about this, right? Like how many people in the world are hypercaloric? Our food is just it tastes so good and there's so many calories in it. And like you said earlier, people eat things out of packages and fast food and they don't realize how many calories they're taking in.
and then I look at the HbA1c and the fasting sugar levels and the insulin markers and something known as the HOMA score. And then when I look at this, we see that sugar really bashes up the nerves in the body, diabetic neuropathy. So forget about getting diabetes. But the logic of Sherlock Holmes would be if somebody could have nerves no longer working when they have full blown diabetes a decade later, rewind to the starting problem where you are in your younger years eating more sugar. And could that excess sugar at that transient point in your life at that moment be whacking your nerves? So there's a lot on a plate that can harm or heal. And final point, go organic, go organic, go organic.
No, I love it. I think there's so much on the nutrition side that we just don't understand and are slowly starting to discover from the science standpoint. And, at least here in the US, most medical doctors are great, but medical doctors don't get a lot of nutrition in school. And so a lot of people I think there's a huge lack of education around nutrition, and when you're on social media, it can be tricky because there's so much contradicting information when it comes to nutrition. So I'm really excited about a lot of the tests you've talked about, especially the genetic testing side. I think I'm going to go do that because I really want to look at my data and see what do I metabolize well, what don't I metabolize well, and how could that affect my body. You talked about there's autoimmune diseases in my family. Actually, my daughter and my wife have autoimmune skin conditions, and we've completely removed gluten. I mean, probably 95%, and it really has made a difference. I'm lactose intolerant. I get gas and dairy bothers me. I've pretty much removed that and the gluten, and I can't believe how much better we feel having that out of our system. So I think it's like you said, it's just you have to think of it as an experiment. You're an N of one, and just the idea of like eliminating things and seeing how your body feels. It just to have it personalized, it's so cool. I mean, our systems are these complex ecosystems. It makes sense that we would have to at some point get to a point where we can test these complex little nuanced things and individualize treatment plans based on that.
Final question before I let you go. If you want Dr. Tom in an alternate life, what would you be?
Ooh, I would have been. Oh my goodness. You know what I probably would have been, what I thought about was very serious about doing before becoming a physio was I would have been a herpetologist. I was going to study reptiles and travel around the world and study snakes and lizards. I was really into.
So, do you have a chameleon pet at home or your daughters don't
I
allow it?
used to. I don't. I have no reptiles right now, but I have had a lot of reptile friends over the years.
Cool. Something very cool about Dr. Tom. All right. Thank you so much for your time today. Have a blessed day ahead. It must be late night there, right?
It's 8 p.m. Yeah, so it's a little my pretty soon I'll be getting my kids ready for bed.
Thank you so much. And God bless you, Tom. I have to send you my book waitlist. I will coordinate with you on WhatsApp and I will send it across to you.
Amazing. Thank you for having me on.
All right. Thank you so much for your time. God bless you.
Bye.
Before we end, I just want to say that this conversation really made me pause and reflect. What stayed with me the most was how Tom explained that pain isn't always about damage and how things like stress, sleep, nutrition, and even our thoughts can change how our body feels. It honestly made me look at my own body a little differently. I also love the way he spoke about muscle, not for aesthetics, it's about longevity, for staying independent, moving well, and aging with strength instead of fear. That one really stuck with me. I'd like to know what was your moment in this episode. Was there an idea or something he said that really clicked for you? Drop it in the comments. I'd love to read it. And if this conversation helped you in any way, please like, share, and subscribe. It truly motivates me and my team to keep bringing in voices like this to educate, simplify, and spread better health awareness. Thank you so much for watching. Yours truly, Ryan Fernando.